Refresh to me is a great drop, don't get me wrong, but it's a band-aid solution. There was a 300% increase in dry eyes according to various studies post-COVID globally because the culture became work from home.
What is the single biggest disaster that people cause with their eyes without even realizing it?
People keep doing is rubbing their eyes. People think it's harmless, but it's kind of changing the shape of your cornea. So blue light, there is no real evidence to suggest that it harms the eyes.
Dr. Ritika Dalal is one of India's most respected eye specialists.
Focused not just on treatment, but on how modern life shapes our vision over time.
People like colored lenses. What do you think about them?
There are surgeries now to have permanently changed the color of your eyes. In the next 30 years, 70 to 80% of children will have glasses. Myopia has almost become like an epidemic. There is no medical evidence that eye yoga can get rid of glasses.
Really?
Yes.
There's so much buzz around Ortho-K lenses.
Lenses which reshape your cornea to wear at night, and then in the day you remove them and you don't have to wear glasses.
And the scary question that can Lasik cause vision loss?
Lasik.
It feels like everybody's taking interest in eye health today. It seems, everywhere it's trending, eye health from screens, like you said, blue light, Lasik. Why do you think that is?
Everyone's taking interest in eye health because our lifestyles have changed completely. Especially post-COVID, the amount of time we're spending on a screen has increased fivefold. Initially, it was just the office worker who had a 9-to-5 job who would be on a computer maybe 2-3 hours a day. Today, it is your college kid. It is even your school-going child who's on an iPad. It is the housewife who's watching, TV or Netflix. You're working from home. So every single person is on the screen for an average of 5 to 6 hours. And the others are on a screen for 10 to 11 hours. So your eyes are working more than double that they are. So we need to understand that this has caused more problems than good also. So people are now aware that, okay, my eyes are not feeling comfortable, they're not okay, and I need to do something about it.
Yeah, it's like, what you're saying is really true. That is it after COVID that happened so much, this massive spike?
Yes, there was a 300% increase in dry eyes according to various studies post-COVID because the culture became work from home, right? So work from home became screen, basically. And when COVID ended, people didn't go back to office. They found it very comfortable. Jobs that could be done from home pretty much were just continued. And then there were so many people who got addicted to TV, right? People who were first going out and playing and stuff like that. Kids, everything. It just became online. Your world pretty much became in one room. So that meant your eyes were overworking and not keeping up.
So it's like the eyes are one of our organs, one of the parts of our body with muscles and everything. And like everything, we're using it. But in the last 50 years, and especially in the last 5 years after COVID, the use of it has accelerated like 5x or whatever it is. And obviously our bodies are not ready for that kind of acceleration. It's like suddenly everybody started running a marathon, 2 marathons every day randomly, and you're like, oh, my legs hurt kind of thing. I think that's a very good analogy to have in your head. Otherwise, you're like, what's the problem? Because it's such a natural thing.
Yes.
And you're not really, I think the interesting thing is you're not really thinking of your eyes when you're watching something.
Yes, of course.
Right.
Unfortunately, you're blinking a lot less when you're on a screen.
Right.
So the strain your eyes feel is a lot more, in fact.
Right.
Because your eyes are working all the time.
Right.
It's like your heart, which is working all the time. Unless you're sleeping, but basically your eyes are working all the time. Except when you're on a screen, you're blinking a lot less. So you're actually making them work more.
What is the single biggest disaster that people cause to their eyes without even realizing it?
So one of the biggest disasters, according to me, is that they don't take breaks while on a screen, okay? Because what happens is a simple thing like taking a break rejuvenates the eyes. You blink, you close your eyes, so the tear film is back to normal. Your muscles get that relaxation, which, they are in fatigue, in motion. So all that can help you in the long run a lot. A second thing that people keep doing is rubbing their eyes. And this is a big disaster for children especially because your eye is still growing. And if you're constantly rubbing, people think it's harmless, but it's kind of changing the shape of your cornea. With every rub, you're constantly rubbing. So making your eye a little more conical, and then that results in different kind of diseases.
Just by rubbing it, you can change the shape?
As a child, yes, by constant rubbing, it's one of the reasons where,
Yeah, kids are always like just rubbing.
so we need to avoid that. We need to get them to the eye doctor to see if they have any allergies which is causing the rubbing, and kind of, help them with the cause. I'm a big believer in sorting out the cause as opposed to just the effect, because then those are band-aid solutions, and as those go, then you continue with the rubbing. So you find out the cause, you treat the cause, and it's kind of more a long-term relief.
And you said breaks, and now you have apps, and on my computer I have a timer, and I keep turning it off because it's really irritating.
Yeah.
Every 20 minutes, it flashes, and you're like, okay, look out of the window or something like that.
Yes.
Can you just explain in a little detail? Because I understand that, I think everybody understands that taking a break is good.
Yeah.
But what is happening when you're looking at the screen? Is my eye like, again, running a marathon, and
Okay.
do I get a break from that?
So that's a good question. So what you're actually doing is you're looking at a screen, maybe an arm's distance, right? So firstly, what you're doing is instead of blinking 13, 14 times, it drops to only 2, 3 times, maybe 4 times. So your eyes are open more, which means the evaporation is much, much faster in the eyes. So the water is leaving the eye faster than it's coming in. So the surface is kind of getting dull and dry. Then what's happening is, imagine you're looking at something close, your muscles are kind of contracting and working so that your screen is in focus. And that's happening all the time.
So when you look at things closer, your eyes work more.
Yes. And which is why when you say take a break, they specify 20, 20, 20.
Yeah.
Which means after every 20 minutes, take a 20-second break. And the last 20 is look at something 20 feet away.
Yes.
But in Bombay, if I tell you to look out of your window 20 feet away, you're probably looking at the other person's TV.
Right.
So close your eyes. If you don't have that luxury of, a 20 feet distance, close your eyes, just break that fusion, get the tear film working again. And, that'll help delaying your symptoms or avoiding them.
What damage is it actually doing? One is it's by, like you said, it's making your eyes work more, and it's drying your eyes out. So what does that mean in the long run?
So in the long run, basically you're asking me, what does a tear film do? Okay, a tear film is the first refracting surface of the eye. So you need a healthy tear film which doesn't keep breaking to see clearly. So in the long run, if you don't have a good tear film, one is you won't see clearly. Secondly, a tear film has a lot of these enzymes and stuff like that which help in healing, preventing infections, preventing bacteria from settling in the eye. So it can make your eye more susceptible to infection.
So it's a film.
It's a film.
It's why our eyes look a little wet always.
Yes. And the third thing what it can do is whenever we undergo any surgery in the eye, even though it's microsurgery or making some cuts like cataract, if you live long enough, everyone's going to get a cataract,
Yes.
right? So whenever you do undergo that surgery, if you suffer from dry eyes or have a poor tear film, your results post-surgery are not optimum. You're not going to get that clarity of vision. You're going to take longer time to heal, and you're just going to be uncomfortable. Your patient is going to come back saying something is wrong. So it's better in your younger age group to, keep that tear film good, healthy, and functioning well for you.
So that's like basically a tear film is like the first barrier of the eye.
Perfectly fine.
And
Correct.
you should keep it, for your whole life. You have to take care of it your whole life.
Yeah.
It's like your skin of your eye.
Yeah.
Got it. And that's what this not blinking dries it out.
Dries
basically.
it out, yes.
And what about the other part of the over exercising your eye?
Yeah, so you get muscle fatigue, what we call, like a lot of people say towards the end of the day, I feel really tired, my eyes are hurting.
Right.
It's all because you're constantly, focused at one spot and you're not giving that relaxation to the muscle.
It's not natural,
like,
basically.
yeah, it's like going to the gym, right? You're not going to keep working out just your one arm. Right? You have days, you take breaks for your larger muscles.
Right.
So it's the same for your eye muscles. You can't just constantly be working
It's
them
like
out.
we're going to the gym and doing bicep curls
All the time.
5 hours a day since
Yeah.
COVID.
And
everybody's
only
doing
that.
And only bicep curls 5 hours a day.
Which you
right.
don't do, right?
Right.
So
Some people, not me. And, everywhere I read about blue light.
yes.
And I'm kind of obsessed with it on my computer, and I put it on that ultra night shift mode, so it almost looks red in the evening. Is that a problem? Is that not a problem?
What you're doing is great though. So blue light, there is no real evidence to suggest that it harms the eyes. But there is enough evidence to suggest that it affects your sleep pattern. So what the blue light does is it affects the melatonin, and it doesn't allow it to be released. It makes your body believe that you're still in day. Like you're still outside, it's still day. So it doesn't allow you to fall asleep comfortably. So that's where the blue light comes into play. So if you are going to be on a screen which emits blue light, any LED screens, any of your computer screens, what you should do is put it on night mode if you're going to use it. Obviously, most ideal is put your device away 2 hours before you sleep. But if you can't do that, decrease the emission by putting it on night mode. But there is no evidence to suggest. A lot of parents ask me, will it help if I make my child wear the blue light glasses? Will it help with, will it not damage the eyes? Well, there's no real evidence to suggest it damages the eyes. So, when there's no evidence for that, I say if it makes you feel better, go ahead, use it. It's not helping you, it's not harming you, it's okay. There's blue light which is emitted in our atmosphere. So it's all around us.
Sure. We're seeing like kids rubbing their eyes all the time. The problem is, how bad is the effect of pollution in India with the dust that we have? We're a very dusty country.
It's very bad. It is actually bad. It does affect the eyes. Pollution and dust, we have these little glands in our eyes called the meibomian glands, which produce oils. And we need that for our eyes to function well. So what this pollution and dust does, it goes and clogs these glands. So it's not ideal. So it's good that, we are aware that these things are happening. Living in Bombay with the construction that we have around us, dust is not going anywhere. So we have to look after our eyes if we want to, achieve best.
So how would we living, like you said, the kids should go outside and play, but it's very dusty. So what can you do? You wash it after they come home?
Yeah, so, just directly splashing water on a daily basis is not great for the eyes because the water we have here is not sterile water. Obviously, you have a lot of bacteria and stuff. And if by chance, while playing, you have a tiny scratch also in the eye and you're constantly splashing water, you're risking infection. It's good to put an eye drop if you need to. Don't make it a habit, but if you need to put an eye drop, do warm compresses which open up the glands.
Everybody uses Refresh all the time now. Why do you say it's not good? I mean, is it okay to use eye drops every day?
Yes, everybody does use Refresh. And that's because they have some amount of dryness. That's why you're using Refresh. Now, Refresh to me is a great drop, don't get me wrong, but it's a Band-Aid solution, right? When you put a drop in the eye, it lasts in the eye for maybe 5 minutes.
Got it.
So when you're suffering from dryness, you're mentally putting a Refresh and thinking, I'm okay, but your surface is okay for 5 minutes. You're not going to put Refresh every 5 minutes, right? So you have to understand that it's helping you for a very short amount of time in the day. Secondly, every drop has some amount of preservatives. Even when they say preservative-free, it has some solutions that you don't really need, right? So when you start using it at even 30 or 40 and you're living till a good 80 or 90, you're putting these drops year on year for so many years. That itself is damaging to the eyes. There was this belief that, dryness initially, when it wasn't a big deal, was seen in a small population of people. And we were like, okay, just put these drops, you're going to be okay. But today, so much research has been done that we have better solutions which avoid using drops all the time. So I would say first go to your eye doctor, get those solutions, and then think of Refresh.
Got it. And what is... when we use eye drops, apparently everybody does it wrong. There's a correct way of doing eye drops, and I use eye drops sometimes also, but apparently I'm doing it wrong. And also something about the expiry date.
Yeah, so I mentioned the expiry date, like do not use expired eye drops, but people think that suppose I've opened a bottle today and the expiration date is in 2026, that I can use it until 2026. Right. That's not true. Once you open a bottle, an open bottle is valid for 30 to 45 days.
That's all?
That's all. And once that is passed, then don't use it, Most of your eye drops, if you're using regularly, are going to be over by then. And the eye drops which you require once in a way, you have to realize you've used it for a week, you've kept it and put it away, but now that's not sterile anymore. So it becomes a place where bacteria can grow. So then after a month, if you again open it and use it, chances are you'll come with an infection.
Got it. I want to talk to you about glasses a little bit, spectacles, as some people call it. When we were kids, only like the brainy students got specs. And now, of course, everybody's getting specs. Why do kids need specs so early?
As I said, because of their lifestyle. Kids today are reading a lot more. They're reading books also near. They're using the Kindle, which is not great. They're playing video games. They are indoors a lot more. They're not going out and playing. So because of that, our eyes are focusing on near work. Whether it's the screen or a book, it's focusing constantly on near work. And because of that, the eyeball is growing. They're not getting the necessary sunlight to stop that growth. And children, myopia has almost become like an epidemic.
Really?
Yes, they're assuming in the next 30 years, close to 70 to 80% of children will have glasses because your lifestyle is such that you're not allowing kids to go out and play. And when you said earlier that usually only the brainy kids would have it, it's because they were reading. They were not the ones going outside and playing as much, right?
Like me.
So what was happening is still the same. It's basically the indoor constant near work and no sunlight and increased screen time, which is kind of giving the kids glasses earlier and earlier.
So when you say near work, there's two things. One is, like you said, a Kindle is not as good. You have books, the traditional near work, and the new near work, which is screens. How would you rate both of them in terms of near work quality?
I would say books are much better. A, they're not emitting light.
Great.
Okay. B, automatically, when you finish a page, it kind of gives you a reminder that you finished the page, you're turning the page, you're blinking a little bit more. Okay. Hopefully you're reading at a good position, good posture, and
Probably
you're reading
not,
hopefully, and you're reading each word. So if it's not clear, you are adjusting. Now, when you're watching something on a screen or you're playing a video game, it's a much larger thing, right? So, if it's out of focus a little, you'll still tolerate it because you're so engrossed in that story or whatever's going on. Secondly, it's emitting a lot of light, right? And thirdly, it's way more addicting than a book.
Yeah.
So while both do cause, if I had to ask my child to pick one, the lesser evil is to read a book.
Got it. Read a book is even better than reading a book on an iPad, for example.
Of course.
Got it.
So I would rate it as book, then Kindle, and then last iPad.
Got it.
Larger the screen, the better, because it's further away from you and it's larger. So I always tell parents, if your kids are anyway going to watch, don't hand them a phone, let them watch on a TV.
That's a very good point.
Yeah.
If you're going to watch anyway,
Just watch on a TV.
Right.
The phone is the worst. It should not have any business other than hello.
Right. Such small text.
It's too small, it's too near,
Right.
and
they're like this. And then your
I mean,
posture also goes right.
Yes, it's everything, In fact, the best posture to have is like a screen. Suppose you're on a computer, it's 1 arm's distance, light from behind, so there's no glare coming on your face. And then you do your work in a comfortable chair with both your feet on the ground. And that's what you should be teaching kids from now. Because most of our kids, as you know, they'll probably be lying on a bed, iPad in front, like this.
Yes.
And
Or just like hunched over. Kids hunched over it.
Yeah. Even when they're doing their homework, they're like all the way there. So I actually keep like pushing my son behind,
Posture. You see a lot of parents trying focus charts or eye exercises, like eye yoga. What are these and do they actually work?
So it depends on what you're using your focus charts and your focus exercises for. Sometimes you have weak muscles, where you may have a little squint or something and they're making you focus. Your near point of accommodation is not as it should be. And then we give you some pencil push-ups and some eye exercises. The doctor will give you those exercises and those are kind of used to strengthen your muscles. But I think what you're getting at is a lot of kids today have glasses and they've been told to do eye yoga to get rid of those glasses.
Yeah, parents freak out when the kids
are. So parents somehow feel glasses is the end of the world and they need to get rid of the glasses immediately.
It's like a personal injury to the parent.
Exactly.
For my mother, it was the same.
Exactly. Yeah. And they feel they've done something wrong. They've not caught it. And now I have to do everything in my power to make sure the child doesn't have glasses.
Right.
Having said that, there are children who go for eye yoga to get rid of glasses. There is no medical evidence that eye yoga can get rid of glasses. In fact, I had a child who I had discovered that they have glasses and the child was perfectly fine wearing glasses. The parent, on the other hand, was traumatized. So they were like, doc, I've heard of this place and I need to go and, do eye yoga. I said, whatever you need to do, you do. But if the child can wear glasses while working, that's best. Right. So the child came back after some time and the parent was so happy. And she was like, eye yoga has worked for my child, really well. They could read the last line and, stuff like that. So I said, oh, that's great. And now our charts, we keep changing our charts around. We have, different numbers, different letters. So I checked the child and I was like, well, to me, it looks like the number is still the same. So I sent the parent aside and I'm like asking the child, I said, wow, why do you read, elsewhere and not in my clinic? And the child is like, I was so tired of going for these eye yoga classes and drinking that kale and that carrot juice that I just learned up the chart. So, that's pretty much what your child is doing. They are tired of doing that sometimes. And then they just mug up the eye chart and you feel that they don't have glasses. But, when they're going to school, they're not seeing. They're sitting on the first bench so that they can, read the board and stuff like that. I say that if it's helping you, great. But go to your eye doctor to make sure that the number is same or no. And if your child has to wear glasses, just give them glasses. It's okay.
It's okay. Anyway, everybody has it.
It's okay.
I really avoided asking you to subscribe till now, but my team has put a gun to my head, so please subscribe. There's so much buzz around Ortho-K lenses and low-dose atropine. Can you just break down what they do and what is it?
Yeah, so Ortho-K lenses are basically lenses which reshape your cornea. They are specialized lenses which you wear at night, and then in the day you remove them and you don't have to wear glasses. So what it does is a temporary fix of reshaping your cornea. It takes, it's not like you started today and tomorrow you're seeing clearly. It depends on your number. The larger the number, more reshaping it takes time. So sometimes it can take up to 2 months to reshape your cornea, and then, in the day you see clearly. But as soon as you stop wearing these lenses at night, chances are your cornea is going to revert back to how it was. So that's the hype around the Ortho-K lenses. Now, as you know, contact lens comes with its own set of issues and problems. So, if you're so motivated, most patients, who are doing this would just go ahead and get a refractive surgery done. If you're so motivated to not wear
You
glasses.
have to wear them all night, basically.
Yes.
While sleeping.
Yes.
And dry your eyes, basically.
You not only dry your eyes, you see they can cause scratches and all if you're not keeping them healthy and in
just
good
not to wear
solutions,
specs in the day.
just to not wear glasses. So I think it's a personal decision.
And low dose atropine?
So low dose atropine is basically diluted atropine to around 0.05%. What it does, it's supposed to slow down your eye number. Okay, so if you have myopia, which when a child comes with myopia, we ask them to come for regular follow-up. So in 3 months, 6 months, if you see their numbers are rapidly rising, it's not, now there's a lot of more evidence. So it is evident that it's not terrible to be using these drops once at night to decrease that number. It doesn't actually decrease the number, it just prevents the number from deteriorating fast. So it kind of slows your progression. So again, the risk and the benefit you have to see. If your number is anyway growing slowly, you're not at risk of high myopia, you may not need it. But if your number is progressing rapidly, then it may make sense to, start using atropine eye drops or these myopia control glasses that they have. So
as if you have only a galloping number kind of thing.
Yeah. So, although I must say there's a school of thought which thinks that if you're hereditary and you are going to get numbers, put it preemptively in your children.
It's safe to use atropine, low dose atropine.
So I feel everything comes with its own set of
Ask your doctor.
Side effects. Ask your pediatric eye surgeon if this is right for you and your child. In my practice, I usually prescribe it to people whose numbers are increasing. I don't think the risk benefit is to just empirically give it to all kids whose parents have glasses, But it basically slows down, it acts in mysterious ways, but it's believed to slow down the elongation of the eyeball.
Got it. Why do contact lenses give headaches?
So contact lenses don't always give headaches, okay? So they give headaches to some people. There are a number of reasons why contact lenses can cause headaches and eye pain. More than headaches, they give eye pain. The reason is, one, if you're wearing a contact lens beyond its expiration. 2, if you're not wearing the correct number. 3, if you're wearing a contact lens which is actually full of debris and it's scratching your cornea. 4 is you're wearing it for longer than you should. All these, or if you sleep in a contact lens, that's the worst. So what contact lenses do, it affects the nerves of the cornea, right? And those, when they are getting
It affects the nerve all the time.
most of the, like in a lot of people it does, that's why contact lens wearers usually get a lot more dry eye, because it affects the tear film. You should have a smooth tear film. There should be a lot of boxes you should tick before you get contact lenses. Okay, and your hands should be clean. There are a lot of things to think of before you actually use contact lenses.
One is, of course, cleaning and putting it on.
Yeah.
But I didn't realize that just the nature of what you're saying is just the nature of contact lenses versus specs, because they sit on this
It's
very fragile layer,
yeah.
is a problem in itself, basically.
Yeah.
So you're saying in general, anyway, contact lenses, no matter how good they are, will cause some level of irritation to the eye.
It does.
Even though you may be fine with it.
Yeah, you may be fine. But when a patient comes to us, we can definitely say if this is a contact lens wearer or not. You sometimes have allergy on your upper eyelid. Your cornea is a certain way. There may be some vessels which are coming onto the cornea because you're trying to get more oxygen in, stuff like that. So you can tell a contact lens wearer from one who doesn't wear contact lenses. So there are many things that go on in a contact lens user which causes eye pain. And then, headaches are usually because a lot of people think this is my glasses number, so my contact lens number is the same. And they just get it made without going to a doctor or without getting a fit. It's very important to go and get a contact lens trial fit. The doctor or the optometrist actually sees if that contact lens is moving with every blink, if it's suitable for your eye. Only then do they prescribe it.
So can you give me all the boxes to tick for someone, who has specs, who's like, I want to get contact lenses? What boxes should we tick?
Okay. So one is they should be old enough, to understand that contact lenses come with its own challenges. Two, you need to explain to them and they need to understand about contact lens hygiene, which means that the contact lens has to be cleaned with the lens solution, not under the tap water or something like that. Three is you have to make sure that that patient understands whether they're wearing daily contact lenses or not. So if it's daily, you have to get rid of it. If it's monthly, weekly, whatever, you have to make sure that all that is done. Lastly, when we are doing the fit for contact lenses, the number is very problematic if it has a lot of astigmatism, if it, all that, we need to do a proper fit. When we're doing the fit, we see how it actually feels on the eye. We see that the shape it's taking is that of the eye. Once the doctor is convinced that this is not harming your eye, it's going to give you good vision, and we say, okay, this is a good fit. Do you feel comfortable? Yes. Then go ahead and use those contact lenses safely. However, if when we're putting the contact lens in, one part of the lens is, up and it's not flush against your eye, or it's too tight or too loose, it's not helping you as much. So then don't go ahead and get those lenses.
And the time thing, I think, is very important.
Time is very important.
A lot of friends I know have wear them the whole day, basically, because
because that's what they want to do.
Yeah. They hate specs,
Yeah. So there is a better solution if they want hate specs. But if you're wearing contact lenses, most people wear them for 10 to 12 hours, and that's the limit. You don't want your
but that's actually too long, you're saying.
It is, yeah.
Because
the less you can wear it, the better,
Right.
But sometimes the worst thing is sometimes people forget to take them off at night. And that is a big no-no, because you can come with horrendous infections in the eye because of contact lenses.
I think that happened to me once, a long time back, yes.
Yeah.
So if someone, has a late night and they, sleep and they forget to take out their lenses, party a bit too much, and they wake up in the middle of the night in the morning and they're like, oh my God, my lenses are there. What should you do?
So, usually when that happens is because they've gone out, as you said, partied a lot, right? Had a lot of alcohol. So already your body is dehydrated. Chances are that the lens is stuck to the eye. If the lens is easily coming off, take it off. If it's not, put a little lubricating drop, see if the lens is moving, then remove it. And after removal, I would suggest, if everything is okay, if you have even the slightest doubt, any redness, any pain, any feeling that it's not like I usually feel, go to the doctor on that same day. Because you can actually prevent a potential catastrophe before it even comes. But yes, it does happen to people. And I think we put in a lot of fear so that they don't do it, because it can actually lead to a lot of damage. But if you've done it by mistake and you're okay, you've gotten away with something, don't do it again.
I think most 20, 25-year-olds would have had at least one or two times.
Oh, more than one or two.
Yeah. Usually you learn with one or two. I think it happened to me a couple of times.
I think once you get an infection, which you have to put drops regularly,
Then you know.
you will never do it again.
Got
But my thing would be, don't wait to get that. Learn from your friend.
Got it. You said that there's a myopia epidemic all over the world, I'm guessing. So everybody's getting specs. Now, even with spectacles, you have lenses, and you have all these different types of lenses. You have Lenskart, which have, lenses at a very good price, sometimes free also. And then you have some insanely expensive, 5,000 rupee Kajal lens, all these different ones, ultra thin, blah, 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 50 different points. What is the difference? Like when you have to choose specs for yourself, for your kids, for anyone?
So for children, I usually say go in for plastic lenses because, when you wear glass lenses, they're playing a ball hitting
Right.
it. Even though a lot of these lenses of the glasses have rounded edges, each piece is rounded. But still we've seen like eye injuries, where the glass has just gone in the eye. So plastic lenses with a band is the best for children.
But any lens.
Any lens, it doesn't matter. See, these are all, you go as an adult, you may want clearer vision, you may want this, you may want that. You go to whichever shop you want. They say the quality is better, you're seeing clearer and all that. So you go try it. Whichever lens works for you, go ahead and use that. A 500 rupee plastic lens is also okay for a child.
Right.
They just need to see, they need to play, they need to be able to have a band so that it doesn't fall off all the time. And, those are the lenses which work for the glasses lenses.
And for an adult, like if you're, 25 or 30 or 40,
So
you can afford.
vanity is a lot for an adult. So it also depends on the kind of frames you choose and all that. The lens itself, it doesn't matter. It really doesn't matter so much which lens you're.
Because when you go to the shop,
They're going to
they
sell
give
you.
they give you like they're like sir 500 hai, but 5,000 ka बहुत अच्छा है, better for your eyes, photochromatic.
Yeah, so what they do is anti-glare, because what they start saying is anti-glare coating is on these lenses. Great, right? If you can afford lenses with anti-glare coating, that's good. It reduces your glare and stuff like that, but you have to realize today's devices, your computer, your phone, your TV, all come with an anti-glare coating itself on the screen. So it's, that's already there on your glow. Some of them say blue light filter glasses. So, it's just one after the other. As I told you before, that blue light is not really harming the eyes. You want to use blue light filter glasses, go ahead, because that's not helping or harming.
Got it.
So, you can sell a glass with a lot of other stuff. Just make sure it's the correct prescription to start with and a lens that you can clearly see through.
Simple thing. Just
Simple.
if you can see through
Keep it simple. And of course, if you're driving at night and you find glare, anti-glare coating will help. If you're driving at night and there's a light coming from front, it might affect you.
Got it.
Because most people use these glasses while on the computer or reading or something. Those screens have anti-glare coating, but your street lights don't.
Got it.
So,
And with contact lenses also, there's so many brands out there, and I remember reading moisturizing lenses. That's what I wear. Moisturizing, super moisturizing, blah, blah, blah. Any simple 2-3 points you have for choosing the right? Of course, you have to go to a doctor, but
yeah, so that's why I keep telling you go to a doctor, because any contact lens seller who is FDA approved, who asks you for a prescription, is right for you.
got it.
Because you're talking about lenses, but people who don't want to wear glasses, they're wearing lenses. But there are a lot of people who are wearing lenses just to change the color of their eye and stuff like that. So I always say go to a person who asks for a prescription, a person who's a known retailer, and who a doctor trusts, so that you're getting what you're paying for.
So basically, ask your doctor before going to some random shop.
Yeah, because now you don't know, right, what kind of lenses, what material, what they're using. Go to a known retailers who
Got
are approved, right, for
Got it.
putting stuff in your eye.
Eyes are the windows to your soul. This is what I've heard. I don't know if that's true. But along with the health stuff like we've spoken about, it's also a beauty situation. So let's talk a little bit about beauty. I think everyone in India has a problem with dark circles, except you, I think. So, what is the number one beauty habit that is damaging eyes today?
That's damaging eyes today or causing dark circles? Because those are not the same.
Well, first damaging eyes, and then we can get into
Okay. So the number one beauty hack that is damaging eyes, according to me, is your Kajal and Mascara. People are putting these dark eyeline pencils and long lashes. What it's doing is it is one, blocking the glands which produce the oils. You are actively blocking those glands. Two, all these adhesive glues for your fake eyelashes and long mascara is again causing issues. A lot of these mascara particles go into the eyes. Glitter is a new phase that people go through where everything needs to be glitter. Those glitter particles can actually go in the eyes and scratch the cornea. So, eye makeup, if not done correctly, can actually lead to a lot of issues within the eyes. So, I'm not a big fan.
You're wearing some Kajal.
Yes.
So then, I just want to understand because I think
so I
every
was just
woman
gonna
wears
say,
it. Yes.
exactly. But I don't wear it very often.
Right.
I'm wearing it because I'm talking to you today.
God bless. God bless.
But so my first thing is, if you ever tell a young girl, don't wear makeup, they're not coming back to you.
Yes.
And they're going to continue doing it.
Right.
So what I do tell them though is wear whatever minimal makeup you can wear, but remove it.
Right.
The worst thing people do is they're so tired after, the whole day that they just think it's okay to sleep in that makeup. So remove it. Even your eye makeup, people remove the makeup from their face very well, but they don't do that to the eye. It's very difficult to remove eye makeup.
Yeah, like how do you remove your...
So what I
Kajal?
do is I actually take a bud, earbud, and I put makeup remover and I pull my eye down and just remove it like that.
Are there 3 hygiene rules that every makeup user should live by?
There are many rules every makeup user should live by, but the 3 top ones I would say is 1, don't use expired products. 2, don't share your makeup. And 3, wash your own brushes.
A lot of people are obsessed with lighter eyes. What decides your natural eye color?
So your natural eye color is actually decided by genetics. Okay, so it's not in your hands. It's basically, it comes from both your parents and it's polygenic, which means there are multiple genes which actually decide. It's not just one gene. So multiple genes decide what color you're going to have. But to simplify it, if you have a lot of melanin in the outer layer of your iris, you have brown eyes. If you have no melanin, very little melanin, you have blue eyes. And in between that, you have your green eyes, right? So that's what decides the eye color. But as you said, yes, people are obsessed with light eyes. And I don't know why that is. I think it's because, historically, everyone says fair, beautiful. People are ones who are fair with light eyes. But also, we have something called a limbal ring, which is dark. So the contrast between the dark limbal ring and a light iris sometimes projects beauty. It kind of.
And also, I think it just looks different because in
India, that's the thing. But blue eyes, everyone wants blue eyes. But the potential risk is also increased with blue eyes because the UV light can go through lighter eyes more. So you may have beautiful blue eyes, but you're going to have to keep them covered with sunglasses because the potential for the UV affecting your retina is more with very light eyes. And, you also go into issues with uveal melanomas and things like that, with lighter colored eyes.
Lots of people like colored lenses. What do you think about them?
I'm not personally a big fan of colored lenses because I feel, as I mentioned before, lenses come with its own challenges and colored lenses more so because you don't actually require glasses or lenses. You're just wearing the colored lenses. But, funnily enough, I don't know if you've heard this, but there are surgeries now to have permanently changed the color of your eyes.
Really?
Yes. So the interesting thing is they make a little pocket in your cornea, in the front part of your eye, and they inject a dye. And they give you a menu card. Which eye color would you like? And you can choose an eye color and they keep the pupil area open and they color the rest of your eye. Now that, according to me, is crazier than wearing colored contact
there are people in India who do this.
There are people who do this.
I mean, there are doctors in India who do this.
I haven't come across doctors who've started it in India. It's very common in the West. There are doctors who are advertising it in the West.
In the West?
Yes.
Where they already have light eyes.
Yes, so they want darker eyes sometimes.
What?
Yeah, some of them go for brown eyes. Some of them, go for green eyes.
Whoa.
And stuff like that. But, you have to realize it's coloring your cornea. And your cornea is by and large meant to be transparent, right? So it affects your eyes in different ways because when you're dilating your eye to see your retina and all that, the color can't go away. So you're going to have to manage with just that much.
That sounds insane.
Yeah. Vanity, as I say.
Wow. Do sunglasses help or is it just fashion?
Sunglasses are your best friends for the eyes. Okay, so UV protective sun gear is a must. You have to wear it every time you step out. So yes, to me, UV protective sunglasses help.
Every time you step out.
Yes.
But
Yeah,
kids
every
should
time
go out without sunglasses and
By
it
and
absorbs
large.
the.
by and large. But for adults, you must.
Got it. I really don't think you have to keep telling them to subscribe. If they like it, they'll subscribe. So, I mean, I think it's fine. I want to ask you about Lasik. Everyone's heard of it. I don't think anyone understands it. Can you explain all these different techniques that exist? Lasik, Smile, PRK, Contoura. What is this? Why is Lasik so huge?
So these are all fancy words and fancy names that come under a broad spectrum of refractive surgery. Refractive surgery is basically surgery to get rid of your glasses. And these are the ways that you actually get rid of them. Contoura, I'm not going to talk about separately because it's just customized LASIK.
Got it.
So you come to three broad categories, which is LASIK, Smile, and PRK, or surface ablation as they call it. In LASIK, what you do is a large cut is made and then you reshape the cornea. In Smile, a small cut is made and a small tissue called a lenticule is removed. And in PRK or surface ablation, you're directly working on the surface of the cornea. So these are the three basic differences. It's important for the patient to know the differences, but I would strongly suggest when you go to your doctor, let the decision on which is best for your eyes be taken by your doctor.
Right. And when you say these cuts and all that stuff, I was wincing a little bit. I was
Right.
like, what happens exactly with all these different things? They're basically cutting your eye and then.
They're reshaping your cornea. Basically, what's happening is you have a number and you want to get rid of that number. So through the lasers, whether they're made after the cut is made, whether they're made on the surface, whether something is removed, what they're doing is they're reshaping your cornea. So the lasers act in such a way that it's reshaping your cornea. And you can wince while I'm saying it, but it is painless and it's quick and it's a relatively safe procedure.
And is it permanent? Are there side effects?
So that's great. There are these myths about LASIK where people actually believe that once I do LASIK means I'm free of glasses for life. That is absolutely not the case because when we are doing LASIK, what we're actually doing is getting rid of your number at that particular time. As we age, you are going to get reading glasses because LASIK is usually done in your 20s or early 30s, right? So when you hit your 40s and 50s, you're going to get reading glasses. Yeah. And the people who've undergone LASIK haven't looked after those numbers. So that is going to happen. So yeah, it's not permanent. And everyone is also not a candidate for LASIK. So you cannot assume that, if I have glasses, I can get rid of them for sure.
So you do LASIK when you have myopia, like when you're younger.
You also have hyperopic LASIK.
Got it.
You also have presbyopic LASIK, which you can do for both numbers.
Okay. But that will still not prevent you from getting glasses in the future.
So it depends on when you do presbyopic LASIK. If you do it when you are 45, you're getting rid of both your numbers. And then there's a possibility 10 years later, your near number increases and you may get some amount.
And what are the side effects? People tell me about dry eyes and more complex things like suicides in America.
Wow, we've just jumped right into it. So LASIK, when done on a correct candidate, is a great surgery. Let me define what a correct candidate is for you. One is the patient should be highly motivated. Let me tell you this incidents where, when it's marriage season, you'll always get these parents. I had a set of parents who came to me highly motivated for LASIK for their daughter who was going to get married, hopefully in a year. And I was like, and I was like, sure, like the arranged marriage scenarios in India. So I was like, sure. And she had a great number. She was a candidate. Her corneas were beautiful. Everything was set. And the girl who was all of 20 is like, you know what? I'm happy in my glasses. I don't want to do LASIK. So those are not right candidates for me. I think the patient should be the motivating factor behind doing a surgery. So if your parents are pushing you, is not right for you. So first and foremost, you should be a motivated patient. Secondly, once you do all the tests, if you have enough thickness in your cornea, if you don't suffer from dry eyes, if your number is stable, you're above 18, and you check all these boxes where you're safely undergoing refractive surgery, then you should undergo refractive surgery. Then comes post-op complications, right? So you have to have a long chat with your doctor on what to expect when you're undergoing a LASIK surgery. If you understand what that is, you're not going to be shocked with the post-op. You cannot touch and rub your eye immediately after surgery. There is a number of period of time that you're going to have to use your eye drops. So if you use them correctly, come for your follow-up, by and large, nothing happens. However, if you've already been suffering from dry eye, LASIK and other refractive surgeries are known to worsen that. So you're going to be miserable with this.
What is Contoura?
So Contoura is customized LASIK. Okay, it's basically you have a topography and you have these abrasions in the eye. You have you map out all your eye in a way that it tells you all the imperfections and all.
Like this whole curve of the eye has got a lot of
Many
bumps.
machines, yeah. So Contoura does customized for your eyes. And it kind of maps out the way your cornea looks, and it kind of corrects it. It's individualistic for each person's eye. It's not a general, like everyone who has a -2 number is not going to get the same laser. So that's what Contoura basically does. In today's day, I'm sure you must have heard there's Innova Eyes also, which has come, which they say gives you even better vision. See, they're all just different companies which come out with different names, which are basically mapping your imperfections and kind of,
Smoothing them out.
Yeah, giving you the best possible vision. But they are all in LASIK. It's not a separate surgery by itself.
They all are part of
it.
laser corrections to your eyes.
Yeah.
And but wouldn't Contoura be better than anything else? Because if it's made specifically for your eye.
So most of the times when we do undergo LASIK, we do Contoura. We just don't say it. It's a marketing way
I
of
see.
saying it.
Oh.
We do map your cornea.
Yeah.
We do the best possible for your eye, but everyone is not a candidate for LASIK. Sometimes you are more suited for surface ablation. Everything has to be, if you are a contact sports player, I don't want to do LASIK for you. And if you are a candidate for surface ablation, I'd rather do surface for you. Rather keep the surface strong. See, with LASIK, you're cutting some part of the cornea, right? The part comes back on the cornea, but it never takes part in the integrity of the cornea. The cut part is always going to be weaker. You're always going to have a flap. You rub your eyes, there's a possibility of wrinkling that flap.
Really?
Yes.
Wow.
So, you have to be careful. So the kind of surgery, that's why I said it's
That's
a
why I
long
was
chat.
rinsing.
It's a long chat, In fact, the laser takes place for 30 seconds. Yeah. But the chat before and after is 30 minutes. So that's the important part where the doctor understands the lifestyle of the patient, understands which surgery is the best, looks at all the maps and all the reports and decides which surgery to do. And the after, where the patient is explained they cannot touch, rub, they have to put their drops and they have to come for follow-ups. That is more important than the 30-second laser.
Can I get LASIK done twice in my life if, like you said, I do it once and then I get a power later?
Yeah, so if you have enough cornea, if your thickness is okay and the stability of your eye is okay, you can get a touch-up LASIK, as we call, where it's a re-LASIK. Whether you're doing it, again, lifting the same flap on the surface will be decided by the doctor. So there are patients who have gotten LASIK done twice or a touch-up LASIK, but that's only if it's completely safe for your eyes. Because we don't want to give you so much laser where, we're risking any other problems, especially like ectasia, where your cornea, becomes loose.
Got it. What do you think are the biggest myths regarding LASIK that just refuse to die?
Like I said, the biggest myth is I've gotten rid of my glasses with LASIK and now I'm never going to get glasses. As I explained to you, yes, you are. Everyone will get reading glasses. 2, LASIK is for everyone if they have glasses. No, it's not for everyone. First and foremost, you have to have a stable number. So a number which is constantly changing is not a right person to get LASIK done. Third, LASIK is such a easy procedure. I don't really have to worry about anything before. Yes, it's easy, but it's easy for the doctor. It's important that you follow what you're supposed to before and after. So, you do that correctly. Fourth is, my friend had no issues, so I'm going to have no issues. That's a big one. Your LASIK story is your LASIK story. Okay, it's never going to be the same as your friend's because every eye is different. So even the difference may be between your 2 eyes. So don't keep comparing. These are like the biggest myths.
What are the biggest mistakes people make after LASIK surgery that can ruin their eyes?
So the biggest mistakes people make is 1, they don't put their drops on schedule like they should. 2 is they don't take the no touching the eye seriously. So we've had patients who've actually rubbed their eyes, because they put a drop and it started burning. So I had a patient who actually vigorously rubbed their eye on the second day after doing LASIK surgery, and there was a complete, what we call, dislocation of the flap and wrinkling. So we actually had to take the patient back in, what we call iron it out, and send them back out. So that's like a big reminder. That patient never touched his eyes. I think he still probably won't be touching his eyes.
But did he have permanent damage or what?
No, so touch wood. We caught it fast and we done it.
When you
but
say
his
ironing it
recovery-
out, I think of a istri on my face.
It's pretty much like that. So
Jesus Christ.
So the mistakes patients make is touching and rubbing your eyes, not putting your drops, not coming for the regular follow-up, because once a week is over and you're completely comfortable, patients tend to forget your 1 month follow-up, 3 months, because I'm okay, I don't need to get checked. So that
Such a quick procedure.
Yeah.
Ho gaya.
So that is the biggest mistake. And of course, not doing your homework. You should be going to a person who is trained in refractive surgery, because people think it's such an easy 5-minute procedure. Any doctor can do it. It's not true. We undergo a lot of training, a lot of cases before we actually operate on your eyes. So it's smart that you do your homework and go to someone who's trained in it.
And the scary question that a lot of people think about, especially me, can LASIK cause vision loss?
So yes, LASIK can cause vision loss, but it is a really, really, really small number. It can cause vision loss in the sense that if something goes wrong and you get a severe infection or something like that, then it hampers your vision. I wouldn't say vision loss, like a scary thing, but blurry vision. Or if you get a complication, like a wrinkled flap, like I mentioned, it can cause blurry vision, any inflammation or infection. But you know what? See, whenever we are undergoing any surgery, there are always chances of complications. The way I counsel my patient is, if there's a complication, I tell them this is the complication and this is the solution. So if I say your flap may wrinkle, but we can iron it. You may get infection, but then you have to use more drops. You may get high pressure, but you have to use certain drops. So if you're going to see a problem and you give them a solution, most patients by and large do well. It is when you have complications in which you don't have a solution, which causes the issues. So can it cause vision loss? Yes. Does it cause vision loss? No.
For most people, when they're looking at doing LASIK, they Google it and whatever comes up first, they go there. What should someone ask the doctor to know that this is the right person and is advising the right surgery?
So the 3 things I would ask my doctor if I was a patient is, first, which surgery are they actually going to do for me? Because as I mentioned, refractive surgery has a lot under it. So which of the surgeries is going to be right for me? Second is what to expect in the pre-op and the post-op, which means what precautions should I do before coming for the surgery? And post-op, what is my expectations regarding my drops, when my vision is going to be clear, when can I start work? And the third thing that I would ask my doctor is what to expect during the surgery. So I'm not startled or shocked what's happening. I would like to be run through the process of what's going to happen, how long it's going to take, and how I'm going to feel. So those are the 3 top questions that I would ask my surgeon.
Got it. You are a dry eye specialist. What is dry eye disease? Because it seems to be everywhere.
Yeah, so dry eye basically is when your eyes either make less water or it produces enough water, but that water is evaporating very fast, or a combination of both. So to avoid dry eye, basically what you need to do is you have to take frequent breaks when you're on the screen, follow the 20-20-20 rule. You have to do warm compresses so that your oil glands start functioning better and it retains more moisture inside the eye. You have to protect your eyes with, your sunglasses, sleep well, eat a healthy, balanced diet. All of it contributes to dry eyes. However, if you're having any of the symptoms on this whole spectrum of dry eye, which could be simply a feeling of dryness, burning, itching, redness, extra watery eyes, tiredness towards the end of the day, or discomfort, go to your doctor so you can be diagnosed whether you have dry eye, which kind of dry eye you have, and get the proper treatment for that.
How common is dry eye disease?
It's very common. As literature shows that there has been a 300% increase in dry eye post-COVID. So almost half the population, if not more, actually has dry eyes.
And you may not even know it.
You may not even know it. So on your regular ophthalmic visit, it's always good to test for dry eyes, because if you're diagnosed early, you don't have to go in for any fancy therapies. You can do in-home treatments.
And what are the early warning signs that a lot of people miss for dry eyes?
Excessive blinking, not being able to sit comfortably in a room where there's an AC blast or a fan overhead, feeling tired towards the end of the day with regards to eyes, or even excessive watering. See, when your eyes are pricking or burning, patients know they have dry eyes and they come immediately. But when you're feeling tired towards the end of the day or there's excessive watering, they don't think, that's not the first thing that comes to your head. They don't think they have dry eyes. They feel like, oh, I'm just tired like the rest of myself. Or if I'm watering, how can I have dry eyes? So these are the signs that patients actually miss and don't come in. So keep that in mind.
And are there any myths about dry eyes that we'd like to dispel?
A big myth is that dry eyes is nothing big and that we don't really need to do much for it other than put over-the-counter drops. That's a big myth. Because by and large, yes, dry eyes is not going to harm you in a very major way. But if you do nothing about it, it is going to cause blurry vision. It is going to hamper your lifestyle. It's going to cause issues with surgical procedures later on. And you're not going to be a very comfortable patient. So a big myth is that you don't need to visit a doctor for dry eyes.
All right. When I lie down in a park and look at the sky, which I do, I used to do quite often. I don't do that. I don't do that much as I used to. I see all these little worms fighting with each other, in my eyes. You have this blue sky and you have all these worms. And like, I remember the first time I saw it, I was like, what the hell
You
is...
made a story in your head.
Yeah. And they move and then and they dance. And then the first time I was like, what the hell is going on out here? And then I realized there's something called floaters and flashes as well.
Yes.
So what are these things?
So what is a floater? So your eye is basically formed of a jelly, okay, which is right in front of the retina, which is known as the vitreous. When that jelly liquefies, sometimes with age, when it liquefies, it casts a shadow on your retina, and that is perceived as a floater, okay? A flash of light that you may see sometimes, it's when the jelly is liquefying and it pulls at the retina. That pull is perceived as a flash of light. So if you have 1 or 2 or 3 floaters, by and large, it's okay. It's an aging process, and it's some people play with it. They're seen more against a white wall and stuff like that. Other than the annoyance thing, it's not really doing anything. But if suddenly from 2-3 floaters you get a shower of floaters of 100, 200, 300 floaters, and suddenly you're seeing a lot of flashes of light or a feeling of a curtain falling, those are your signs that you need to visit your eye doctor immediately. You cannot wait for 3 days and 5 days and a week. You need to go immediately, because those are signs that your retina is getting damaged or detached. And that is an important thing.
I have more than 3 floaters for sure, but not hundreds. Yes. I'm just looking right now. There's a lot, but yeah.
You're okay.